The following segment is sponsored by Northern Nevada Health System.
We are with Mike Tobin, a registered nurse here at the Sierra Medical Center. You work in the ER as a nurse, and you see all kinds of things. But this time of year, respiratory issues are a big concern.
Yes. Yeah, we see a lot of respiratory issues with adults and pediatric patients.
So what are the signs and symptoms? If I'm seeing something in one of my family members, how do we know when to come to the hospital for a respiratory issue?
So I'd say adults and pediatrics are going to present very similarly, especially for mild respiratory symptoms. So you're going to see things like the mild shortness of breath, cough, fever, headache, body aches, chills. Those would be signs of a viral illness. And then you could start seeing things like maybe increased respiratory rate. That'd be a mild virus that would probably be causing a respiratory illness.
Something to call 911 over or not?
We would recommend that you call 911 if you're starting to experience severe shortness of breath. You can't do basic activities like doing laundry or walking up a flight of stairs for adults. For kids, if you notice that they're becoming lethargic or they're unable to play and keep their breath like they normally would be able to, if they start having nasal flaring or their belly starts really working, or you see retractions where their skin actually starts to suck into their chest wall cavity, those would be very concerning findings, and we would recommend that you call 911 or come to the ER.
And before we come to the ER, you recommend there are some things we can do to prepare for our visit to the ER.
Yeah, so one of the things that we really need to know is how long the symptoms have been going on, what are some medications that you've been taking to help treat the symptoms, any pertinent medical history that you have, like chronic medical problems. And then if you are on oxygen regularly, these patients typically are affected more with respiratory illnesses, to make sure you bring a portable oxygen device with you so that if you are discharged, you have a way to get home and be safe.
All right, let's talk prevention when it comes to respiratory illnesses. What can we do right now for good folks at home to keep ourselves from coming to see you at the ER? Not that you're not a delightful human being to come visit.
Some basic things would be washing your hands, using alcohol-based hand sanitizers. You'll see them when you're going into the store. That is a really common place that people are touching everything, and then you're touching your face and then you're getting infected that way. If you're immune compromised, making sure you're wearing a mask during the winter and fall months when we see these viruses most prevalent. And then if you are someone that has like asthma or severe respiratory problems like COPD, those are all also patients that we recommend are really hypervigilant about washing their hands and staying away from people that are sick. Specifically for kids, we see a high impact with kids with RSV, so respiratory syncytial virus. And so if you don't know this particular child and someone's introducing you to a brand new child, a 6-month-old, a 12-month-old, a young child, we recommend not to kiss them or to say hi to them that way. You can
even grandma and grandpa?
I would recommend that because a lot of times adults don't have symptoms of RSV and you could pass it on to a child and they end up getting very sick from it.
Mike Tobin, thank you so much. Appreciate your time. Yeah. And for more information about what they do here at the Sierra Medical Center and everything else, just go to our website,